The Dental Brief is brought to you by Omni Premier Marketing and the amazing guests who bring wisdom and advice that you can put to use to take your business and practices to the next level. Find us on Facebook and join the conversation. Get ready to grow because we are kicking off the next episode in 3, 2, 1.
Hello, everyone. Welcome to another episode of the Dental Brief. I'm excited for today's guest. We're going to talk about team building and some other amazing things. Without further ado, Dr. Michael Neal, say hello to everyone.
Hey, thanks, Patrick. Welcome to the podcast, and I'm very excited to be here.
Yep. I'm going to say right off the bat, I know you work with dentists, help dental practices. We're going to get into the details of that. But when I say Dr. Neal, you're actually an optometrist, correct?
Sure am. Yeah, absolutely. And I've been an optometrist for a little over 20 years in private practice the whole time, northeastern Pennsylvania.
Yep. So we're going to get into how you started working with dentists just a little bit. But tell us, how do you start Build My Team? What made you start helping with recruiting and team building and these types of things?
Yeah, it wasn't done on purpose. It was done out of absolute necessity. Our practice was hiring people based upon the traditional hiring methods of using resumes and interviewing, and it was terrible. We live in an area where there's very few qualified people. It's basically a talent puddle instead of a talent pool. And what we discovered is that trying to get experienced people in a lot of times caused just as many problems as getting, the wrong hires in. And so we started to take a look at different ways that we could improve things and hire differently.
Yep. And, this is obviously, I'm going to showstopper here. We know why you got involved in dentistry, right? Because dental, it's been a huge issue for even before the pandemic, but since the pandemic, it's even blown up. So I'm sure that your phone's ringing off the hook with dentists that are calling you. When dentists are calling you, what are some of the biggest challenges that they're having? What are they calling you about?
Well, ironically, it's not just dentists. It's like what we feel, or we have problems with in eye care. Dentists have problems with in dentistry, and so do all the other clients that we have in other types of private practices. A private practice is pretty much indicative of the fact that you're going to have staffing issues nowadays. So dentists, getting killed by hygienists, having all kinds of issues with that type of position. Certain states allow FDAs, you name it. But on our side of things, it just comes down to who does a patient see when they walk through the front door of the practice? That's usually one of the first impressions. And we want the team members to be as fantastic as possible, as does the practice.
Yeah. So one of the things that is a common, it's almost an everyday conversation that I have with dentists, our clients, is answering the phones. Right? Getting people trained up to answer the phones, being worried about training because the person's going to leave. They don't want to invest all this money for someone that's going to be gone after lunch today. I've heard I was in a room not too long ago with, I think about 14 dentists, give or take a few. And they asked how many people in the last year have hired someone to have them leave, not show up the next day. Yeah. And about half the room raised their hand. They said, well, what about someone who started and didn't come back after lunch the same day, and the other half of the room
boy, that's terrible.
Yeah, so it's really, really problematic. So let's take a deep dive. Let's talk about keeping employees, hiring right, and keeping employees. What's the secrets here? What are the tricks?
Well, a couple of things that Build My Team does. We handle the entire hiring process for a practice, between an initial consultation call that finds out the type of person or the type of position you're looking to fill, all the way through to we send over absolutely fantastic candidates. So what's the secret sauce? Well, it's algorithmic. For each position, we're looking for different types of people. So for example, a front desk position, medical secretary, dental secretary, it doesn't matter. They're all the same type of person for that particular role. We're looking for somebody, and there's pages of characteristics of what we're looking for, but some quick top ones. Friendly, that everybody can agree on. However, then we get into the other stuff too. Like, for example, stress tolerance. It is not an easy position to be at the front desk in a dental practice. We can all agree on that. It's hard.
Sure.
If you don't think that it's hard, I would ask your listeners to take a couple minutes and go try it themselves. They won't last 5 to 10 minutes, and then they'll be out of there. We want somebody who is extremely stress tolerant because they have to have that characteristic in that position. We want them to be able to do multiple things at once. Somebody's going to be standing in front of the desk talking to them while they're answering a phone, while they're doing this, that, and the other thing. The list goes on and on. Now, if you contrast that to a different position, like let's say a biller, a dental biller, that's a completely different skill set. And so what we have found over all the positions we filled is that they are very algorithmic, and what makes a terrific person in one role may not make them a terrific person in another role. So that's the first thing. From there, we don't use resumes to hire. That's a little bit of a really different approach. We have an entire assessment process that's all text-based, like literally a text message. That's how it starts on the cell phone for the candidates. And they go through it. And by the time they're done, we know what their natural talents and strengths are. Hiring based upon a resume is how you get all those hands up in that example that you use, because the resumes don't tell you what you're good at. That's the issue. The reason everybody uses resumes is essentially that's all that have been available up till recently. And our approach determines what they're naturally good at. So to get a person to stay past lunch, like you mentioned, what you want to do, excuse me, is make sure that that particular candidate walks into a position and is using their natural talents and strengths. They're naturally good at it. And that's something we can determine. So when it's a mindset shift for dentists, when they want to keep people long term, the only way to do that is to make sure that they're actually doing what they like to do, what they're naturally good at. Otherwise, if it's super hard, if it's a slog for them, what happens? Right. Those hands go up and out the door they go.
Right. Yeah, it makes sense. I mean, a lot of those positions I would really dislike. With my experience, I think people look at a resume, they would consider me for a job, especially when I said, hey, I'm looking for something with these hours, Monday through Thursday, flexibility, what have you. And then maybe that makes the hire, and it turns out, wow, I'm really frustrated in this position. I like to be very careful about what I say when it comes to, being careful not to offend people. But really, a lot of relationships that don't work out in all types of business, not just dental practices, really it's about not being good at hiring more so than bad candidates. Do you agree with that or no?
Remind me, how many dental classes do dentists take on hiring?
Right. 0.
I mean, we know the answer to that, right? So, and if you look in the corporate world, it doesn't matter if you've been in HR for 20 years, you're still struggling as well. You just probably struggle a little less. We can all agree on that. What my company did when it first started is we looked at how Disney, the Four Seasons, Ritz-Carlton, those types of companies, how are they hiring? We reverse engineered the process, and they don't use resumes. They start off with that, essentially, to get candidates into their funnel, but they're all based upon assessments. And they start off at the interview stage already knowing which candidates can do a spectacular job. It's a completely different way to hire.
Yeah, let me interrupt you there for a second too, because pay becomes part of the equation too, where money starts to become something to think about and talk about. And with Disney, and I want to be careful about what I say here, but I'm pretty sure I've seen some headlines about Disney in California, trying to get out of California's minimum wage law so they continue to pay low wages to their employees. And I take my kids it's got to be a hard job, right? You're outside in the weather all day long. You're on your feet all day long. You're dealing with and being very happy about dealing with people that are very upset a lot of times or angry or worse. But yet Disney seems to keep people for a very long period of time, don't they?
They sure do, as do any of the high-end customer service organizations. And folks don't generally tend to think of healthcare as such, but you've got dental. I mean, there are people listening to this right now who have 5-star dental practices that a person can walk in and spend, 5 figures, mid 5 figures on cosmetic dentistry. Well, I got news for you. That's a high-end customer experience that you have. And if you're not matching that experience with team members that can provide that level of air quotes, customer service, then there's a discrepancy there. And that's a bit of a chasm that will cost you in terms of revenue, cost you turnover, both in staff and in patients. And it's unnecessary. There's a new way to do this. It's all hiring based upon strengths and talents. And we're not looking for people with experience. That's one of the keys. So you mentioned earlier with the training, one of the things we measure is a person's speed of learning. So guess what? When you take somebody who really likes the job, is loving the fact that you gave them an opportunity, they're naturally good at it, and they learn lickety split, guess what happens? You can teach them. And back to your original point, Patrick, docs are always worried about, well, I don't want to invest in people training wise. What's the alternative?
Right.
I mean, literally, what is the alternative? You put somebody who's a schmuck at your, sitting there in front of patients, untrained. Well, we can't do that. So flip this around. Let's get somebody who's already been measured to be quick at learning, get them in the position. And then all you basically have to do is tell them what you want done. You show them once and off they go with, essentially amazing everybody.
Yep. Yeah. Your website's buildmyteam.com. Man, you got one heck of a domain name there.
But thanks.
Easy to remember it. It makes total sense. So buildmyteam.com. Dr. Neal, tell me this. One last question for you. There's a lot of companies out there that do hiring and do recruiting, or they say they do hiring and do recruiting. And I'm sure there's some that are fantastic and some that who knows so much about. How do you vet someone? How do you go about finding the right fit for you to help build your team?
Well, it's pretty straightforward. As I said, we've developed an entire process that all starts from a text message. So within 5 seconds of a candidate applying for your position, they get a text message. We hit them immediately with this so that they can start going through the process. We reject approximately 97% of candidates. So why are we doing a better job than other folks? Well, we reject almost everybody. We're only sending over the people who are known to be able to do the job. And we do this around North America over and over again. So the question I would ask your listeners is, how many times a year do you hire people in your practice? And you take that number and just realize that our team at Build My Team hires that many people by lunch.
Yep.
That's the difference. So we have an expert organization that is designed to do one thing only, algorithmically, methodically, with feedback to get better and better. And that's how we're able to perform at the level that we are for dentists.
Yep, makes total sense. It's kind of a tricky question, so it's not one more question. This will be the last one. But I think when people hear algorithmic or they hear automation and these types of things, they start to think, well, it takes the emotion out of it. Isn't this really a people-to-people thing? But taking the emotion out of it, actually emotion is what causes a lot of bad hires, doesn't it?
Oh, you betcha. Don't worry. The emotion's right back in during the interview process.
Sure.
What we're doing is we're methodically looking for people who will be superstars in your practice. We want A players, and we're going to bring A players to the table for interviews. Now, just remember, we've all heard this before, but A players love working with other A players. They tolerate B players, and they're going to quit their job because of C players. Yeah. So if emotion is built into your entire process, you will continue to get the same results that you've been getting. And I say that respectfully, but it requires a mindset shift by your listeners to do things differently. And when they do things differently, guess what? You do get different results. And this is something that we've been doing around North America over and over again.
Yep. Awesome. Dr. Neal, buildmyteam.com. We appreciate you being here. Come back on.
Thank you so much, Patrick.